Hello, everyone. Good evening. I'm very happy to welcome Poulami. She's a doctoral scholar at Center of Behavioral and Cognitive Sciences. She will be speaking on clinical and experimental insights from statistical measures of neuroimaging. Poulami, welcome. Over to you. You can start the discussion.
Yeah, sure. Hi, I'm Poulami, and as Sir said, that I will be talking about a few things. And instead of saying this large, title, I'll just tell you guys why I am talking about this. So, my background is in mathematics and physics and statistics, and I eventually ended up working in clinical neuroscience because of my research interest. So, I see a lot of students from biology, psychology, joining in the neuroscience course, and obviously these days we see a lot of engineers as well. But I wanted to let everyone know that the mathematical and the statistical scope in neuroscience and neuroimaging these days are huge. If you look at Southeast Asian countries but you did not have the information, I really want you guys to know about this, and eventually if you want, you can pursue along these lines. So that's the reason why I am going to talk about a few interesting things about neuroimaging and how it is related to physics and mathematics and statistics in general. Okay. So, to begin with, let's just understand what neuroimaging is, right? So, as you can see, it's a combination of two words, neuro and imaging. So, it's basically the idea that we are imaging the neurological situation of our brain. So, it can be the anatomical changes in the brain, or it can be the functional changes in the brain. So, what are the anatomical changes? See, there are brain regions, like about left and right hemispheres, frontal lobes, occipital lobes, and they are all associated with different types of functions that they help us performing our behavior, our motor movements. These things are coordinated by our brain, right? So there can be anatomical changes in our brain. Why? Because there can be diseases like, you know neurodegenerative diseases that kills the neuronal cells in the brain. For example, it can be Alzheimer's, it can be dementia, Parkinson's. Similarly, there can be injuries. What kind of injuries can cause brain damage? There can be car accidents which cause severe brain damage. Sometimes there are construction site falls which cause brain damage. These are the two main types of brain injuries that people suffer from. And then there can be developmental problems. Developmental problems usually come in children. You may have known about cerebral palsy. You may have seen people with cerebral palsy. But also, other than cerebral palsy, which does not only manifest in our brain but manifest in our behavior also, it causes physiological difficulties, it causes mental difficulties. Along with that, we have autism and ADHD. These things are not visible, but there are changes, subtle changes in behavior. These kids may have problem like focusing on their studies or any work that they are doing. They can be very hyperactive. So these are the developmental problems. All of these can cause anatomical changes in the brain. They can like change the region of the brain, or you can say there is more or less activity in that brain region, or you can say that that region has been impaired or affected because of the diseases or the injuries. Now, let's understand the functional changes. Why are there functional changes in the brain? There can be various things. One is obviously the things I have described, like the developmental problems, the diseases, the injuries. These obviously can cause functional changes in the brain because they are altering the structure. But other than that, it can just be because of we are growing up. So when children grow up, the way they respond to certain things when they are child and when they have grown up into adults, they will respond completely differently. So we learn from our experiences. It can be learning about the environment, it can be learning a subject, it can be learning social cues. We know how to function in a social environment much better as an adult compared to a child. So along when we grow, these brain regions also develop. So because of these developmental changes, the functional changes also occur in the brain. So our brain now can function differently from when we were children. Okay, so these are the reasons why anatomical and functional changes in the brain are important, and neuroimaging can actually help you study and visualize those changes in the brain. Next thing is, what are some neurological methodologies that help us with neuroimaging? So I will go from the historical perspective so that I can tell you about the chronology, because all of these things were invented for particular purposes and they have to be following a particular chronology. For example, the first methodology that I will talk about is CT scan. So before CT scan, we did not really have any kind of methodology that could look inside our brain, because brain is soft tissue, it's not bones or hard tissues, right? So there were nothing that could actually give a image of our brain. So what did it hinder? It actually it actually caused a lot of problem for the patients, because diseases were still there. There were people who were suffering from memory problems, people who were suffering from speech oriented problems, there were people who were obviously going through brain trauma because of accidents, injuries or infections, but none of these things were getting the proper treatment because no one could see inside the brain. So they did not know which area has been affected. For example, if someone has viral encephalitis, one needs to know which area in the brain is affected. Only then the right diagnosis and treatment can be given. So these things were unknown to doctors and patients. So that is where CT scan came in. The working principle of CT scan is very simple. So there is a machine. In the next slide, I have provided the images also. So in CT scan, there are usually 4 X-ray tube inside the machine, and they are rotated across the head of the patient, and it takes the image from various angle of the patient. So what is important in this case, we measure the intensity of the X-rays that pass through the tissues, and these intensity actually capture and reconstruct the detailed cross-sectional images of the brain. So we can see it on the computer, like we see for our, when we break a bone or when we have some kind of injuries, we go to the doctor and they give us an X-ray. So it works the same way, and it obviously has advantages. Like I told you that there were a situation where no treatment could be provided for these severe diseases. So CT scan can actually detect injuries, in infections, tumors, and also vascular diseases like strokes. Also, there is something called a contrast. What is a contrast? So there can be intravenous injections, or wherever there is a edema or a swallowing place in your brain, there can be an injection which actually help the doctors to see the blood vessels that are involved in that region or that injury more clearly. And because of all these situations, as in all these problems it can diagnose, now treatment of these problems are very easy, because doctors can now diagnose tumors, infections, injuries and vascular diseases just from a CT scan. Now, even though it has a lot of advantages, there are also disadvantages. What kind of disadvantage does it have? So as you can understand, people are getting exposed to X-ray. So obviously there is radiation exposure, and long term radiation exposure is never good. So why can it be long term? When patients have infection or they are going through tumor or cancer, they need to get their scan done every 3 months or every 4 months to track the progress of the disease, how the disease is progressing, whether the cancer is coming back, whether the tumor is increasing in size, right? So they have to get the scan done repeatedly, and that can actually cause like a lot of radiation exposure, which is not good for health. Another thing is, I mentioned about the dye, right, the contrast. And in many cases the contrast dyes are not suitable for the patients. They get allergic to the dye, they can also have kidney issues, and also it is not good for pregnant women or women who are breastfeeding. Other than that, even though CT scan is very good, and obviously it is considered to be a medical wonder because it helped doctors diagnose so many things, it did have its own disadvantages. And one of the biggest disadvantages, it can only capture the structural problem of the brain. So if a person goes to a doctor and tell them that, I am having memory problems, and doctors suggest them to do a CT scan. So they go and do a CT scan, but the region that is associated with memory is hippocampus. Now, if the doctor doesn't find any injury in the hippocampus, any tumor in the hippocampus, or any infections, then what will the doctor diagnose the patient with? Because these are the only things that CT scan can actually diagnose and identify, and these are not there in the hippocampus, but the person is still suffering from memory problems. So in this case, the problem is not a structural problem, it's a functional problem, but CT scan cannot identify that. For that, we need PET scan. That is why PET scan was invented. PET scan can actually identify the functional problems in the brain. It can actually see the metabolic changes and the functional physiological changes in the brain in real time. So how does it work? In PET scan, there is always a injection in a small dose, which includes a radioactive tracer. Now, this radioactive tracer will emit positron, which interact with the electron in our body. There are free electron in our body because we have a lot of water in our body, right? So that produces the gamma ray. And these gamma rays are what the doctors capture. So that is how PET scan helps. I'll give you an example. So let's talk about the patient who came to the doctor with memory problem. They did not have anything structural problem in their hippocampus. So what was the problem? In this case, the doctor injects the patient with a radioactive tracer. This radioactive tracer then lights up the regions in the brain which have abnormal deposition of certain proteins. In this case, it will show an abnormal deposition of amyloid beta protein. So what is it associated with? Abnormal deposition of amyloid beta protein is associated with Alzheimer's. That is how the doctor will diagnose the patient with Alzheimer's. This is exactly why PET scan is needed. When there is no structural problem, the problem is functional. When your endocrine system and your peptides and proteins are involved, CT scan cannot help you. That is why you need the PET scan. So as you can see, it has its own advantages. It provides information about physiological and metabolic processes. It also can detect early changes in cancer, like I talked about the progression of the disease, right? So because it involves a radioactive tracer, it can also predict how the cancer is going to develop eventually, because it can always detect the changes in your internal peptides, proteins, and if there is any abnormal deposition, it can actually detect very early compared to CT scan. So in case of CT scan, when you go to the doctor, the patient already has a structural deficit. CT scan will only capture that. In case of PET scan, because there is a radioactive tracer, it can already tell the patient far before the tumor has progressed into cancer, that there is a chance that this tumor will progress into cancer, or there are already cancerous cells present in the tumor. So these are the very important advantages of PET scan. But again, PET scan suffers from the same problem. Radioactive tracers are there, so there is radiation involved. It also has these the radioactive tracers are also not very suitable for all kinds of patients. For example, people who suffer from chronic kidney diseases or heart diseases, they may be very sensitive to them. Also pregnant women and breastfeeding patients, they are also very sensitive. So when you compare it to the CT scan, it is very, very helpful, because it can detect changes that CT scan cannot do. But then again, PET scan also has its own disadvantage. So the next thing is, we have to take care of both the disadvantage together. We need to detect the functional and metabolic changes in the brain, because that is required to diagnose the diseases. But also we need to make sure that the machine cannot be radioactive, because if a patient is getting cancer, or if a patient is getting neurodegenerative disease, we need to capture the progression of the disease. So how do we do it? That is where MRI came in. And MRI uses a strong magnetic field and radio frequency waves, but it does not have any radiation involved in it. So, how does it work? It basically aligns the lone hydrogen atom in the body uh, along the strong magnetic field that comes with the machine. Now, when that alignment is done, a radio frequency pulse is sent to the machine, which cause a disruption in that magnetic field, and that disruption is basically caught in the computer as the signals, which shows the brain and the various types of images it can give us. It can give us the changes in gray matter. It can give us the changes and development in white matter tracts. It can also shows us the real-time changes in various regions, which are important for crucial activities or crucial behaviors. So in case of advantages, it provides excellent contrast. The images are very clean. Compared to CT and PET scan, we get much better resolutions of the images. And it is very useful for, mostly if you look at severe neurological disorders, which causes neuronal cell death, which causes changes in the gray matter and white matter tract. There it is very important. And another thing is, it can create very good, like, precise 3D images of the problem. So the MRI scan can give us 3D images. And in terms of disadvantages, I wouldn't say it is exactly a disadvantage, but it is very expensive. And there are also few problems like noise, because it uses a strong magnetic field, and uses the repeated radio frequency pulse to generate that distortion. There is a continuous noise, and that noisy background can be a bit difficult for patients who have claustrophobia, who cannot stay in closed space, who have overstimulation, cannot really take a lot of sound or noise. And there is also a problem that when the patients are inside, now the patients who have neurological problems oftentimes show motor sensitivity. They will have like repeated movements. It can be like very random eye movements. Sometimes if the patients come with Parkinson's, they will also have a little bit of movement of jaw, lips, and the head. So these motion sensitivities are there. So initially it was a big problem, but now we have softwares where we can code and actually remove these artifacts, these motion problems that are there. So these are the images of CT scan, PET scan, and MRI. And yeah, so these are just for references so that you can see what these machines look like. So what makes MRI unique? MRI is unique because it captures neural activity in a very special way. So it does not directly capture the neural activity. It is rather sensitive to blood oxygenation level dependent signals. It's also known as bold signals. So what happens when a neural activity is happening, when a neurological action is taking place, we always use more oxygen than we have consumed. And because of this, the hemoglobin associated with oxygen increases, that proportion increases. And as well, because the oxyhemoglobin is increasing, the proportion of deoxyhemoglobin will reduce. Because deoxyhemoglobin has very strong paramagnetic property, the paramagnetic property is also reducing, and that reduces the magnetic susceptibility. Why is there magnetic susceptibility? Because the MRI machine is working on a strong magnetic field, and that magnetic field is not always constant. It's a strong field, but inside the field there are variations. At T0 it can be like a certain value of the magnetic field, but in a different time, like at T15, that magnetic field strength may have changed. So because of that, there is a magnetic susceptibility which also generates eddy current inside the machine. Okay, so when the paramagnetic property goes down, the magnetic susceptibility also goes down. And when the magnetic susceptibility goes down, it produces very strong MR signal. This strong MR signal, as in magnetic resonance signals, are the signals that are captured as your brain image. It can be white matter tracts, it can be gray matter tissue, or it can be certain regions in which you are interested in for a particular disease. Now, the two techniques that I will discuss today are functional MRI and diffusion MRI. And what are these things used for? So, functional MRI mostly help in investigating the real-time activity or lack of activity in various brain regions. And these activities can originate from any mental mechanisms, such as when you are studying, you are focusing on something you are studying, right? So you are basically focusing your attention to a particular task. And how you control your attention? Are you easily distracted, or can you focus your attention very well? It can be switching language. So when we talk, we don't always talk in one language. If you are in a multicultural setting, you may have friends with whom you need to converse in different languages. So that is called language switching. Also, when you are writing, you have a different region of your brain associated with writing. Memorizing, like I said, hippocampus is associated with memory, recalling, etc. Also, any kind of physical or motor action, such as when you are moving your eyes, when you are blinking, when you are catching a ball or throwing a ball, these can also have different types of motor activity in your brain, and all of them will actually have different activities in your brain, which fMRI, as in functional MRI, can actually show you in real time. So if you are inside a scanner and you are participating in a experimental behavioral task where your particular behavior is being tested, so we have something like attentional control task, where whether your attention is shifted quickly or you can focus is tested. We also have language switching task, where we see that if a person can switch language fast, or it actually takes them time to switch their languages. Similarly, there are texts for which you have to read and answer a few questions. It actually tests your language comprehension. So these are the things, some experimental behavioral tasks that people actually do when they are lying inside the scanner, and we actually scan the brain when they are doing the task, and we capture the real-time activity with functional MRI. And lack of activities is something that we often see in various kind of diseases, especially neurodegenerative diseases. For example, in case of Alzheimer's, you will see that there is very less activity in the hippocampus, because the synapses that connects the neural network in the hippocampus are not that strong anymore, which is why you will see that there are very less activity. In Parkinson's, you will see severe lack in activity in something called basal ganglia, which is associated with motor movements. Similarly, there are irregularities in case of children who have attention deficit hyperactive disorder or autism. Some children also suffer from speech problems. They do not talk until until they are 10, 11. So and sometimes even after that they have to go to speech therapists to be able to talk, to be able to communicate. So these are the situations where there are irregularities and lack of activities. So functional MRI can help us understand our behavior, as in which region of our brain is associated with a particular behavior. You can actually study a new behavior and find out the new regions that are associated with it, but also it can help us see what kind of irregularities or lack of activities are happening in case of people who are suffering from developmental disorders, who are suffering from various neurological disorders. So that is why functional MRI is very advantageous in these cases. And then we have diffusion MRI. So, diffusion MRI is actually dedicated to white matter tract development. Why is white matter tract important? So, white matter tract is associated with plasticity of the brain. What is plasticity of the brain? Whenever you learn something, you are learning because of your experiences. You are experiencing something, and from that experience, you are learning, right? So, whenever you have experience based learning, something inside your brain change. It's called the wiring of the brain. So, what actually happens is your white matter tracts become more and more involved in a particular activity. If you uh, play cricket and if you actually have training in cricket, you will eventually become better at cricket. Why? Because the white matter tracts, like internal capsule, which is associated with motor circuit, corpus callosum, which is associated with motor circuits, these will have better plasticity. So these plastic changes will actually be helping you with your practice. If you are playing on the field, so you will become better and better with a particular sport, with a particular behavior or particular thing you are learning. So whenever you learn something, there are plastic changes in the brain, and that basically makes our white matter development even better and stronger. So whenever there is a stronger white matter development, it comes as an effect of training, as an effect of experience. But the opposite can also happen. For example, when people age, the white matter tracts associated with memory, recalling, and also motor movement, they get a bit weaker, which is why you will see that old people have trouble remembering, they have a trouble doing certain things, because the white matter tracts are not working like they used to work when they were young. So like we have plastic changes when we become adult from children, we also have plastic changes from when we are becoming old, from when we are adult, right? So these plastic changes diffusion MRI can capture. It's very important to see if a patient is suppose if a patient has problem where white matter tracts are affected, if you do diffusion MRI, you can actually see what stage of the disease the patient is in and how fast is the disease progressing. Based on that, the doctors can actually change their treatment regimen. They can also change the dosage of their medicine. Also, we can now develop different types of neurologically targeted therapies for these patients. And in case of training and other things that sometimes are studied in children, especially children who suffer from developmental problems like attentional deficit or speech problems, if they're given certain kind of therapy or treatment, in their cases sometimes these diffusion MRIs are done to check whether the plastic changes are happening, whether they are learning social cues, whether their attentional network, memory, etc. are improving. So these are the things that diffusion MRI can help us doing. Now, how do we collect the data? So I have already said a few things, but I'll just mention how we do it. In case of functional MRI, usually we collect the data when the patient is in or participant is inside the scanner and they are performing an experimental behavioral task, right? It can be visually switching of attention, it can be answering questions to a paragraph, and in this case, the real-time activity of various parts of the brain are captured through the scanner. So we can see what brain regions are, associated with the mechanism of visual attention or language switch or language comprehension, etc. These I have discussed. So one thing that is very important to understand, the duration of the experimental task that we are using inside the scanner, it has to be similar to the duration for which we are collecting the scan. If both of these do not match, then either you have less number of brain volumes or less number of slices of the brain compared to the task we have done, or we have a problem with the thing that your scanning has ended but your task has not finished. So both the things has to be of same duration, as in if you have a scan time of 1 hour, then your behavioral task should also be of 1 hour. These two has to sync. In case of diffusion MRI, it's very easy. We do not need to take any kind of behavioral task. In this case, the patients or the participant will just lie inside the scanner and you can just do a diffusion MRI. Why? Because here we are tracking the white matter tracts. We are basically seeing the changes in the white matter tracts, right? So it is not really important to see whether they can perform a task correctly. Here you will just see whether there is plastic changes in the white matter tracts, and then when the data is collected, we go further with various types of analysis which gives a statistical measure that is enough for comparing. Take the medicinal history of the patient, what medicine they take for their own disease, what kind of other medicines are going on for their comorbidities. For example, a Parkinson's patient or an Alzheimer's disease patient can also have heart problems, can also have a diabetes. They can be taking different medicines for those. So you need to take a history of those so that when you are analyzing, you have a correct notion that these other medicines that they are taking is not affecting your data, right? Now, there are some important parameters in MRI in general. So, when we do functional MRI, we basically look at the magnetic field strength. Usually, the magnetic field strength in the MRI machines that are used in hospital is between 1.5 to 3 Tesla. But there are like MRI machines which are 7 Tesla, and the highest one that I have seen is 14 Tesla. But usually 1.5 to 3 Tesla is good enough. The more the magnetic field is, it will also increase the susceptibility oriented artifacts, because whenever there is a higher strength of the magnetic field, there is more susceptibility and it will induce more errors, more noises in your data. Even if you can correct them, there is always a chance that some of the noises will be left, which is why it's important patient time. So I have talked about how the MRI machine works, right? Whenever it aligns those lone hydrogen atom in its own direction, we send the radio frequency pulses. So these radio frequency pulses are sent repeatedly to the machine. So the duration between the two pulses, as in the time, that the duration or the gap at which each of these pulses are being repeated, that is the time of repetition or repetition time. So it's basically the gap between two radio frequency pulse, two chronologic radio frequency pulse. And then we have echo time. When we send this radio frequency pulse, the machine takes some time to send back the signal, which we capture as the brain images. So this gap between the radio frequency pulse that we are sending and the signal we are getting back is the echo time. Then we have flip angle. Flip angle is very common concept of physics. So this is basically the angle by which the distortion in the magnetic field is taking place. Usually when you are setting a protocol, is kept at 90 degree, but if one needs, they can go up to 120 degree. But again, if one increases the flip angle too much, there is a chance that the signal to noise ratio may be affected. So, based on the task they are studying and the neural mechanism they are studying, they should fix their flip angle. Then we have voxel size. So, voxel size is again another interesting concept. The MRI machine does not see your brain as the brain structure, rather, it sees the brain as a cluster of small cubes. These cubes are called voxels. So, it basically sees the brain as a cluster of cubes, and all of these cubes have their own length, breadth, and width. So, these cubes are called voxels, and usually we try to keep isotropic voxels, and the usual length, width, and breadth are between 2.4 to 2 to 4 millimeter. So why 2 to 4 millimeter? Because if we actually increase these voxel size too much, it can actually lower, like reduce the signal to noise ratio. If the signal to noise ratio is reduced, then we will not be getting very good MR signals. That is why we keep it between 2 to 4 millimeters. Then we have field of view. Field of view basically is a window that we get in our computer that you can set for the participant's brain. So usually FOV, or field of view, is kept near the region that you are interested in. So if you are suppose interested in the basal ganglia, then you will have to keep it in the middle of the brain. So the basal ganglia can get scanned, or you can get the image of the basal ganglia. That is why field of view is important. Again, field of view will always be dependent on the brain region you are studying. Other than that, we have slice thickness. Slice thickness is basically during the scan, again, the machine will slice your brain up in multiple pieces, right? So suppose your brain is, in terms of the data you are collecting, your brain have 0 to 100, as in 100 slices of the brain, right? Now, are all these slices important? No. Only those slices which come inside your field of view, as in the region you are interested in, those are important. And again, for slice thickness, we keep it 2 to 4 millimeter, so that the artifacts, the signal to noise ratio keeps being strong, and we get strong MR signals. Then we have number of volumes. Number of volumes basically it's talking about the brain volumes that are involved in these cases. So if you take more volumes, it will improve your statistical power. So if you keep very less number of volume, it means that you are collecting data for a very small portion of the brain, and it does not really have any validity or reliability. So it's better to collect data for a much larger portion, so that there is less distortion in the signal. There is less distortion in the white matter tract you are capturing. So the more your volumes are, the more your statistical power will become. But sometimes what happens is, see, again, we are working with human patients, and because this kind of work is mostly done with a clinical population, the patient is already suffering from a disease. So when they are inside the machine for a very long period of time, they sometimes experience fatigue, and they actually fall asleep. If they fall asleep, there will be a problem capturing the actual mechanism of the brain. So that is also something to keep in mind. And in diffusion MRI, we have a few extra steps, as in extra parameters, which is B value. It basically indicates the strength and timing of the diffusion gradient. So in diffusion MRI, what happens is we capture the diffusion of the water molecules along our axons of neuron, right? So we need to actually see that in which direction the water is diffusing. So to keep a track of those, we need to have the strength and the timing of the diffusion gradient, so that we can keep a track of the motion of the water molecules. And the typical value is kept between 0 to 1500. Again, if you have very high B value, the more diffusion sensitivity you will get, the lower your SNR will be. The signal to noise ratio will drop. Again, your MR signal may be distorted. And we also have number of diffusion direction. Just like you have to have a strength and timing of the diffusion gradient, you also need to know in how many directions are the water molecules flowing, and how many directions should be good for your data. So it basically defines in which directions you are studying the flow of the water molecules. Usually in case of normal diffusion MRI, we keep it between 30 to 60, but sometimes in very strong MRI machines like 7 Tesla and 14 Tesla, there are situations where they can go up to 100 to 200 directions. It's not always good for data. I think there's a very like common misconception in neuroimaging that if I do more number of diffusion direction, I will probably collect better data. Your diffusion direction has nothing to do with your statistical power, because you are collecting data from one brain. Your statistical power should be capturing more information from the brain, not more information from the direction of the water molecules. So that is a very common mistake that I have seen happening, and it's better to keep the diffusion direction between 30 to 60 so that your signal to noise ratio does not drop. And now comes the handling of the data. So first I will talk about the functional MRI, which is on the left, and diffusion MRI, which is on the right. So if you have, there will be a few words that may be a bit confusing. Do ask me questions. I will drop my email with sir. Yeah. So when we collect the data, I am sure you have seen CT scan or X-ray plates, right? The images that come on those black plates. So that is the data we get from the machine. They are called medical files, and we cannot directly start working on them. Before we start working on data, we have to convert them into nifty files, which are neuroinformatics files. So for this, we use a software called MRI cron. These convert our data into nifty images, which are neuroinformatics images. So once that is done, what we do in functional MRI, we are working with brain, right? But the image that is captured, it also captures our skull. So the first thing we do is we strip the skull so that we get better images of the brain. Okay. So that is called skull extraction. So once that is done, we again go back and try to take care of the motion errors that are there. These motion errors or artifacts have been introduced because of the eye blinks, the head movement that comes from the patient. So these are taken care of. And then the other errors that are there, which are basically coming from the magnetic susceptibility, the varying eddy current, these are also taken care of. So the function that is used for this on a particular software, which is called FSL, is MCF-LIRT. Okay, so there is no like large name for this. It's a function. It takes care of all the noises and errors that are there in your signal. And then there is something called smoothing. So smoothing is very important. Whenever a brain region is activated or deactivated, the regions which are very adjacent to that activated or deactivated region also get some of those activation. Now see, this particular region is not itself activated. It's just getting some of the activation because it shares some of the neurons with the actual activated region. So smoothing will actually tell you which are the critical region and which are not. The region which are not critical should not go into your further analysis. Only the regions which are critical will go into your further analysis. So once the smoothing is done, you can go to your second level analysis. So the particular analysis I am explaining here is in terms of a study. This study is done by one of my colleague, Dr. Roy. He is looking into the subclinically depressed patients and their risk and reward behavior. So what he did, he designed a study which studies the risk and reward behavior of people. And he collected data from subclinically depressed people and healthy individuals. The motto of this study is, if people are subclinically depressed and we can see it in their behavior, we can actually ask those people to seek therapy or medical attention so that it does not evolve into depression, because subclinical depression, when people's depressed moods are already heightened, is where the suicidal thoughts begin. So that is how we can actually make the depression situation better in India. If we can diagnose patients and study their risk and reward behavior when they're subclinically depressed, we can probably give them treatment, and it can become better before they actually are diagnosed with depression. Okay. So, in the second level analysis, what we do, we actually, yes,
I'm sorry to interrupt, Poulami.
yes,
So we are
yes,
almost out of time. So
yes.
maybe if you can quickly wrap up in the next 2 minutes, then we can take questions.
Yeah, sure, sir, sure. So, in the second level analysis, we basically develop contrast between situations like risk and reward. And once that is done, we basically do a cluster correction. In cluster correction, what we do, we basically cluster the regions which are associated with risk and which are associated with reward. And because we can compare between the risk and reward, it helps us to see which regions are activated for risk and which regions are activated for reward. And then there is a second level analysis, which is between group analysis, where we are basically comparing between the subclinically depressed individuals and the healthy individuals. So here again, we create the contrast. Here we can compare the healthy individuals with the subclinically depressed people, or the subclinically depressed people with the healthy individuals. And here again, we do a cluster correction where we only take the regions which have a p-value less than 0.05 to maintain the statistical significance. So these gives us images which shows us what are the regions that are different for risk and reward, and also it can show us what are the regions that are different between subclinically depressed people and healthy individual. And the other kind of data analysis is the diffusion MRI analysis. So the first few steps until the motion correction and the other artifact correction, eddy current and magnetic susceptibility are common. And after that, we reconstruct the tensors to obtain measures like mean diffusivity, radial diffusivity, and fractional anisotropy. These words that you are hearing, they are basically measures of how profound or diffused your white matter tract is. If it is
Okay,
profound, then it
Poulami,
is
thank
working
you.
fine.
Sorry for interrupting again.
Yeah,
We are
yeah.
all we are completely out of time.
Yeah,
So
yeah,
if
sir. It's done. It's done. It's the last. I think there are two more steps left. Then it's done.
the students will be going to a class from here.
Okay, 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 okay. Sure, sure. No problem. No problem at all.
If
Yeah.
anyone has any question, can you quickly raise your hand and maybe we can take a couple of questions because we are almost out of time. Or if you do not have any question right away, you can also send us the problems and I will request Poulami to share the PPT
Sure,
as well
sure, sir. I
so
will
that,
share the PPT. Yes, yes, yes.
okay,
Definitely.
okay. Thank you, Poulami, for such a great talk. I'm sure many students will be interested in the long run to pursue research in this direction. This is one of the most exciting areas of research in the 21st century.
You could say that, sir. Yeah, it
Yeah.
actually
So
helps a lot.
brain is, they say, the last frontier, right? So yeah. So thank you for again. Thank you very much for this fantastic talk. We hope to hear from you soon again in the future.
Sure,
Uh,
sure, sir. Sure.
Okay. Let's conclude the session here. Thank you, everyone. Bye.